Your period blood is changing colors, and nobody's talking about what it really means. Pink one month, dark brown the next, maybe even orange or gray. Here's what terrifies most women. You think it's normal until it's not. Could that watery pink flow mean your hormones are crashing? Is dark brown blood hiding something dangerous inside your uterus? What if that grayish tint means infection and you've been ignoring it for months? Most women think menstrual blood should always be red. That's wrong. Your period tells a complete biological story about your hormones, your nutrition, your stress, even hidden conditions developing silently. This video reveals what each color actually means and which ones demand immediate medical attention. Today, I'm breaking down every single period blood color you might see. You'll understand the science behind each shade. I'll show you exactly when to worry and when to breathe easy. By the end, you'll have a step-by-step action plan for the colors that matter most. No more confusion, no more Dr. Google panic at 2 a.m., just clear answers. Before we talk about colors, we first need to understand simple breakdown, some basics. Your period isn't just blood. It's a mix of blood, uterine tissue, and cervical mucus. Your uterus builds a thick lining every month preparing for pregnancy. When pregnancy doesn't happen, your body sheds that lining. The color depends on two simple factors. First, how fast the blood exits your body. Second, how much oxygen touches it. Fresh blood that flows quickly stays bright red. Blood that sits longer oxidizes and darkens like a cut apple turning brown. Your hormones control everything. Estrogen thickens your uterine lining. Progesterone stabilizes it. When hormones fluctuate, blood flow and appearance can change. Your period color shifts naturally throughout your cycle as flow speeds up and slows down. But here's what doctors rarely mention. Some color changes signal your body is screaming for help. Certain shades point to infections that spread fast. Others hint at hormonal crashes that destroy bone density and fertility silently. Most women miss these warnings because they don't know what to look for. I'll reveal the danger colors in a second, but first, you need to understand why your period can betray you. Root cause. This isn't your fault. Your period reflects your body's internal environment. Stress floods your system with cortisol, disrupting estrogen and progesterone balance. Intense exercise without proper recovery tanks your hormones. Poor sleep destroys the delicate dance your reproductive system needs. Your thyroid controls metabolism, but it also impacts menstrual flow. During perimenopause, estrogen levels fluctuate unpredictably, changing period appearance. Even your diet affects iron levels, hemoglobin production, and ultimately blood color. You're not broken. Your body is responding to its environment. Understanding this gives you power to fix what's off. Everyone thinks pink period blood automatically means low iron or anemia, but medical research shows iron deficiency doesn't suddenly make blood pink. Hemoglobin doesn't work that way. Pink blood usually just means your flow mixed with cervical mucus, diluting the red. It's most common at your period's start or end when flow is light. This is normal biology. That said, persistently low estrogen can cause pink discharge at unexpected times throughout your cycle. If you see pink repeatedly mid-cycle with fatigue or irregular periods, get your hormones checked. The color itself isn't the problem. It's the pattern. Dark brown color. Dark brown or black blood freaks people out. They assume it means something's rotting inside. Wrong. Dark blood simply means it oxidized. It sat in your uterus longer and reacted with oxygen. This happens naturally at the beginning or end of your period when flow slows down. Black blood typically appears when flow is slower and is generally harmless. Brown blood also shows up during implantation bleeding in early pregnancy or as postpartum discharge. If you're not pregnant and brown blood comes with foul odor or severe pain, then see a doctor. But the color alone, usually harmless. Gray-red color. Now the colors that demand action. Gray or grayish-red blood is never normal. Orange or gray period blood often indicates infection. Gray discharge usually signals bacterial vaginosis, an overgrowth of vaginal bacteria. If you've recently miscarried, gray tissue mixed with blood can appear. Either way, gray demands immediate medical attention. Orange color. Orange blood often means infection too, especially if it smells bad or causes pelvic pain. Trichomoniasis and pelvic, no exceptions. Inflammatory disease commonly produce this shade. These conditions spread and worsen fast. Don't wait. Green-tinged blood. Green period blood indicates vaginal infection, possibly an STI, and requires immediate medical evaluation. No exceptions. Surprising micro-hack. Here's something that blows people's minds. Your flow color can change based on your posture and activity level. When you lie down for hours, blood moves slower and darkens. When you're active and upright, circulation improves and blood stays brighter. The fast result plan. If your period colors concern you, here's your immediate action protocol. Days 1 to 3, track everything. Note the exact colors you see, flow, heaviness, clots, pain levels, and any odor. Take photos if comfortable. Doctors appreciate visual records. Day 4, compare your notes. Are you seeing gray, orange, or green? Call your doctor immediately, same day. Don't wait for your period to end. Day 5, if colors are pink, red, or brown, without foul odor or severe pain, you're likely fine. But if pink appears mid-cycle repeatedly or you feel exhausted, schedule a hormone panel within the next 2 weeks. Week 2, get tested. Request a complete blood count to check for anemia, iron levels, and red blood cell health. Add a hormone panel checking estrogen, progesterone, and thyroid function. Week 3, based on results, supplement if needed. Low iron requires iron-rich foods plus vitamin C for absorption. Low estrogen might need lifestyle changes. Reduce overtraining, manage stress, improve sleep. Week 4, track your next period. Note any improvements. Repeat until your colors stabilize into healthy bright to dark red patterns. This aggressive approach catches problems early when they're easiest to fix. Your period blood color is a language. Most color changes throughout your cycle are completely normal. Blood naturally darkens as it oxidizes. Pink at the start, bright red in the middle, brown at the end. That's textbook healthy. But your body also uses color to send urgent messages. Gray screams infection. Orange warns of inflammation. Persistent pink whispers hormonal imbalance. The shift happens when you stop seeing your period as shameful and start treating it as data. Track it, understand it, act on it. You deserve a body that works smoothly, and now you know how to read the signs when it doesn't. Your period isn't your enemy, it's your monthly health report. Start listening.